At this point, I'm going to now invite the Commissioner UNHLDS, Dr. Susan Nabadda, and she will be making her remarks at this point. Dr. Nabadda, welcome, and thank you so much for accepting.
Thank you, Professor Killian, for that very, very informative presentation. Good afternoon, good morning, good evening, colleagues. I'm very happy to be part of this webinar that is looking at laboratory system strengthening and discussing the achievements that we've gained as the laboratory, at the laboratory sector, Ministry of Health, with support that we get from our development partners and the implementing partners. As you've already heard, a lot has been done by our Global Health Public Foundation. He has elaborately told us what they've done and supported us. So I'm just going to give you a progress of the laboratory systems as it has evolved with the support that we've been getting. Laboratory services, as you're all aware, are very, very critical in the laboratory healthcare delivery system because of the roles that they play. Over 75% curative and public health decisions really depend on quality health laboratory results to support disease management. And I insist quality health laboratory results, not just health laboratory results. And also laboratory services promote rational use of medicines, and they also promote early detection, identification, and control of emerging and re-emerging diseases. And we know that laboratory medicine with evidence-based equals scientific evidence to a doctor. The only way that clinician can know that this is through the lab. And not only that, also laboratory services help us out in so many things like treatment options, detection of diseases, follow-up of treatment, training of healthcare professionals, innovations and research, surveillance for disease prevention. So there is need to strengthen all these lab systems so that we are able to achieve this. And because of the importance of laboratory services, Ministry of Health elevated the laboratory unit from a small unit to a whole department to be able to achieve the role that the laboratory services play. So as we speak now, we're a whole department in the Ministry of Health, Department of National Health Laboratory and Diagnostic Services, with a mandate to provide stewardship for National Health Laboratory Network so that we can guide the prevention and management of disease in Uganda. And our vision as the department is to offer quality health laboratory services, and I insist again on quality health laboratory services that are available and are accessible to all people in Uganda, with a mission of providing quality and cost-effective and sustainable health lab services to the people of Uganda to support healthcare both regionally and subnationally. And the main mandates of the department are two. We have a mandate of coordination of laboratory services through our main objectives that are four. One is strengthening the leadership and governance structures for effective and sustainable laboratory service delivery at all levels. And we do this through different areas, looking at organization and management, human resources, looking for finances, resource mobilization and management, and strengthening laboratory systems through partnerships. The other objective under coordination is to provide quality and equitable laboratory services at all levels. And to do this, we do this through support and coordinating infrastructure, biosafety and biosecurity, equipment and supplies, quality management systems, and community health promotion for lab services. In areas of strengthening laboratory information management and utilization of the lab services, we do this through coordinating and supporting health laboratory information management systems and monitoring and evaluation. But we also have an objective of creating an enabling environment to promote research and innovations. And through this, we do operational research to inform policy. But the second mandate that the department has is to offer specialized reference testing services at the national level. And we have a different number of laboratories, as you would see them listed. We have that supranational reference laboratory, TB laboratory. We have the National Microbiology Reference Lab, the National Proficiency Testing Production Lab. We have the HIV, EID, HIV drug resistance lab, a viral hepatitis lab. Recently came up with a COVID-19 lab, both central and the mobile labs. We have a national specimen biorepository laboratory, and we also have a national equipment calibration laboratory. And now we are developing a malaria reference lab. I just want to update you and highlight how we link up our public health laboratory network in the country. As the department in the coordination aspect, we directly coordinate and supervise the laboratories in the laboratory tiered network, right from Health Center 3 to the national reference laboratories that we have. Through Health Center 3, Health Center 4, general hospitals, regional referral labs, and the national reference laboratories. But we work hand in hand and we collaborate with other institutions. We work hand in hand with the animal health laboratories, warehouses, university research laboratories, and specialized laboratories like UVRI, Makerere Blood Bank. We work hand in hand with the different regulatory bodies like Allied Health Professionals Council and Uganda Medical Dental Practitioners Council, and we also work hand in hand and oversee the private labs. But we also coordinate and work with the other departments in the ministry that have lab-related programs. So we take leadership and stewardship in coordinating this. So then this tiered network, Ministry of Health selected 100 laboratories that are strategically located throughout the country. And this is what we call the National Sample Results Referral Network, the hub system. It selected these 100 hubs that improve their infrastructure, equipment, human resources, and quality management systems, design the national sample transportation system, design test menu for the different levels of care to be able to refer tests which cannot be done at different levels. And through this system, we have noted improved access to quality laboratory services, even to the farthest parts of the country. And this is the map of the different hubs that we have. And this map and the support to develop these hubs was through our development partners, as you can see, through CDC, DOD, and USAID, and they are still currently supporting us in this. I just wanted to give you a background of the whole laboratory structure, and now I'm here to give you the achievements that we have gained with support from the different development partners and implementing partners that have supported us to improve laboratory services and improve access to quality laboratory services. These are the different development partners that are supporting government of Uganda, and the support they give us is through the different implementing partners. As you've already heard, the support we've got and the achievements we've achieved through a Global Health Public Foundation. They've clearly stated how the funding from these development partners has enabled them to support the different systems in the lab. I'm just going to give you highlights of the support we've achieved that have moved us from where we are and where we are now. One area is improvement in the laboratory infrastructure, both nationally and the subnational level. And this was because of the funding through the different development partners to the different implementing partners. Currently, we speak of a home for lab services at UNHLDS in Butarika, but we've noted improvement of our infrastructure lab, the infrastructure of our laboratories, even up to the district and health center force. These are just highlights of the different labs. Like Chenjojo Hospital Lab was well supported and improved through support from our development partners. And we also have regional referral labs like Mbale Regional Referral Lab that has been built to the state of the level of the infrastructure that we have, but this is all because of the support from the different partners. The National Hub and Sample Transportation System that was supported by PEPFAR through CDC to promote access to quality lab services. As we speak now, our 100 hub network connects over 300 health facilities, and these 300 health facilities have 300 motorbikes from spoke to the hub, and then we have vehicles that transport these samples to the different, to the reference laboratories in Kampala, TSU, VRI, CPHL, and more health. And because of the support we've had from the partners, we able to transport over 2.5 million samples per year, including all kinds of samples, HIV, viral load, EID, TB samples, AMR samples, outbreak investigation samples, COVID-19, cancer diagnostic samples, and animal health samples. And as Uganda, we pause of this sample transportation network because the early response to COVID that we had initially depended on only 2-3 labs at the center that had PCR capacity, but this was only possible because of this sample transportation network that had been built, and this was built on support of our development partners and the implementing partners that support the hub operations. Under quality management system, it has been ably and elaborately spoken up about by Professor Killian, because we received a lot of technical assistance from our Global Health Public Foundation to support our improvement in our quality management systems. And we've noted this, and this has improved access to high quality laboratory services in the country, and it has uplifted our country to laboratories that are comparable globally. He has given us the journey where we were and where we are, and currently we speak of 33 labs that achieved international accreditation in Uganda. But on top of that, we also have the National TB Reference Lab that is accredited beyond ISO 15189 to ISO 17043. We also have the EID Viral Load Lab. On top of being accredited for SANAS, it's also a WHO pre-qualified lab for molecular diagnostics. And of recent, the National Microbiology Reference Lab was recommended for CAP accreditation. You all know that accreditation really guarantees access to quality lab services that help out in disease management. And because of the support we've got from the different partners and different implementing partners, we were able to achieve this. But specifically, our Global has really given us technical assistance in quality improvement of our quality management systems, and we applaud you on that. We thank you very much, and you've driven that journey to see that now we have about 33 laboratories accredited, and also we have a number of certified auditors, both for biosafety and for quality. Under data management, health laboratory information management systems, with support still from our development partners through the different implementing partners, we are able now to have a data hosting center with a capacity of over 68 that hosts not only laboratory information systems, but also Ministry of Health information systems that have enabled us to automate lab processes, enable us to return results. And the beauty is that all this is done by our own in-house software developers with support from different development partners. We are able now to have interoperability between different systems, and we are very grateful for the support given to us through our development partners and the implementing partners to have this done. Global Health Public Foundation was really instrumental in developing the EQA dashboard. We got a lot of help and technical support. And currently, as you all are aware, if you get to do an EQA dashboard, you can monitor and track the performance of the quality of our lab. So we thank you very much for that. He has spoken a lot about the National Equipment Calibration Center. It was this was with support from CDC, we were able to have this calibration center, but with support from a global, the center was accredited, and currently it is supporting a lot of certification and calibration of the different laboratory equipment across the country and supporting the regional maintenance, equipment maintenance centers. He has already spoken about the support he gave, Global gave us through certification of biosafety cabinets, not only in the reference and regional referral labs, but also across the animal health labs. So it's a very, very resource that we have. And we've actually noted that we are actually saving a lot of money that we would have used in case we were outsourcing these calibration services. This has been possible because of the collaboration and the support that we are getting from the different partners, but our global was very instrumental in having this done. Under the National Microbiology Reference Lab, it really played a critical role in the investigation of disease outbreaks and surveillance. It was very critical when COVID came up to support the response, and this was because it had already had the trained people, the quality that was needed for people to move out to be able to do that testing. And as we speak now, we have a robust national microbiology network. We've spread out in 9 regional laboratories, regional hospital laboratories, but also in the animal health laboratories. But this capacity building that we've had in terms of equipment, in terms of human resource, has been possible because of the support we are getting from our partners, CDC, PEPFAR, CDC, WHO, Fleming Fund. So as we speak now, at least we have a network of 9 laboratories that are able to do AMR surveillance, and more are being brought on board with support that we get from our development partners. For TB and the National TB Reference Lab, you all are aware that now we have, it's a supranational reference laboratory that provides surveillance and early detection of both MDR-TB and XDR-TB. But the journey, you can see where it started from a small room, but because of the support that we've got from CDC, from WHO, World Bank, we've been able to move to get a structure for TB lab, which is also a supranational TB lab that supports even over 23 countries across Africa. But this has been possible with the support that we've been getting from our different partners. And we have also increased access to TB diagnostics using GeneXpert. We have a number of like 258 GeneXpert sites across the country. And as you've had from support from our global, at the time of COVID, they helped us certify and move around, certify the different biosafety cabinets in these different GeneXpert sites. So we are very grateful for that support that they've been giving us. And through that support that we've had, we've innovatively integrated the different technologies that we've seen, the information systems, the sample transportation network, to improve and deliver quality laboratory services, even to the lowest health center, which makes us achieve and meet our vision of quality laboratory service that is accessible to the lowest health facility. So as you can see here, you can see this lab at CPHL, but this person in this Manyata is able to receive a quality result from this lab that is in Kampala and on real time. This is because of all the innovations that we've done, and this has only been possible because of the support that we've been getting from our development partners and through the different implementing partners like our Global Health Public Foundation. So I really want to appreciate the government of Uganda for the support, and as we continue to lobby for increased funding for the laboratory services as government of Uganda, but also appreciate the continued collaboration with the development partners and implementing partners as they support the laboratory system strengthening. You've all clearly seen how the support from CDC, PEPFAR to our global has really enabled us to improve our systems in terms of quality, in terms of biosafety, in terms of waste management. So we really appreciate that this continued collaboration with the development partners and implementing partners, and we request for this continued collaboration. Thank you very much for listening to
me. Thank you very much indeed. Dr. Susan Nabadda, Commissioner, UNHLDS. Thank you very much for your remarks and for showing how the country has actually progressed. Indeed, now at this point, I'm going to take the opportunity to please invite my then PO, Dr. Christina Mwangi, to make her remarks and go on and invite Dr. Lisa Nelson for her remarks as well. Francis, you might have gotten the message. We've just tweaked the program just a little bit. We're going to listen to Dr. Christina Mwangi first from CDC, and then we'll come back to you, Francis.
Thank you, Professor. Greetings to all my colleagues, whichever part of the world you are in. I will be giving my remarks, and I will then follow on to give Dr. Lisa's remarks because she is not in. She unfortunately had to leave because of other competing priorities. I will say all protocol observed, as I apologize, I'm not able to see who is in the room, but I will recognize the Commissioner, National Health Laboratory and Diagnostic Services. As I was listening to a global public health foundation, whom I shall refer to from now on as the foundation, my mind kept on going back to a favorite subject that I have, which is the history of medicine and the history of diagnostics. So if any of you have read that from ancient times, from the different parts of the world, and compare it to what we have now, it's actually worlds apart. From where medicine used to be based on humors to where it is now based on quality laboratory results. So as you do know, CDC's main strength is in its laboratory services, its capacity to detect, to provide the evidence on which public health interventions are based. And that is what CDC really stands for, Centers for Disease Control and Prevention. So as I speak now as the project officer, previous project officer for the foundation, I would like to first of all thank the Ministry of Health for leadership and direction. We wouldn't be where we are if the Ministry of Health was not steering the boat. To all partners, development as well as implementing partners, thank you for the support. As CDC, we would not have been able to do it on our own. To the foundation, it is as though you found children all at different stages of development. You nurtured them, you mentored them, you grew them. Some have reached different stages of maturity, and that's what you presented. their accreditation, some with few scopes, others with many. As you transition, you are handing these children to JCRC. But we believe that you will be available to assist, to mentor, and to provide whatever assistance it is that you can, so that whatever it is that you found, which you took over, which you are handing over to someone else, will continue to grow and will be maintained. As your project officer, I appreciate your expertise and your dedication to quality, your ability to form partnerships and relationships which furthered quality management system strengthening in Uganda. As you transition to other opportunities, which I hope will be in Uganda, but wherever you go, we wish you all the very best. And that is from your project officer. I will now transition to my other hat, which I've been given this afternoon, which is to give Lisa Nelson's remarks. From Dr. Nelson, CDC recognizes the importance of quality laboratory systems. Laboratories produce test results which are widely used in clinical and public health settings, and health outcomes depend on the accuracy of the testing and reporting. Therefore, laboratory results must be accurate as possible. All aspects of the laboratory operations must be reliable, and reporting must be timely to be useful in a clinical or public health lab setting. The US government through CDC has had a long-term working relationship with the government of Uganda as early as 1991, when the CDC laboratory started at Entebbe. This laboratory received recognition as one of the first labs to attain the College of American Pathologists accreditation in sub-Saharan Africa, and the foundation played a key role in ensuring that this lab attained that accreditation. Since then, CDC has maintained a presence as a major partner to the government of Uganda in strengthening and raising the profile of laboratory services, including the support for developing and implementation of the National Health Laboratory Services Policy and Strategic Plan, the lab information system, supply chain, infrastructure development, equipment management, just to name a few. CDC has been the natural partner for the Ministry of Health, and it has spearheaded the improvement of quality laboratory management system, starting by the 19 laboratory hubs as centers of excellence to the current more than 100 hubs across the country. CDC is committed to the continued collaboration with the government of Uganda in strengthening the laboratory systems and networks as a core value within its supported partners to ensure informed, quality clinical care, and ultimately improved health for the people of Uganda. The SLAMTA program, Strengthening Laboratory Management Towards Accreditation, was developed by WHO and CDC to improve the quality of laboratories throughout the developing world. It is a competency-based training program designed to enable laboratories to implement practical quality management systems and encourage continuous quality improvement. With support from CDC, SLAMTA implementation in Uganda started with a pilot in 19 laboratories in 2009, and then rolled out as a national program in 2010 and beyond to all the 100 hubs. Audits using the SLIPTA, Stepwise Laboratory Improvement Program Towards Accreditation checklist, are conducted by ASLM, the African Society for Laboratory Medicine, certified national auditors, with laboratories scored on a 0 to 5-star scale to measure progress in laboratory quality improvement. Through this program, the Ministry of Health has been able to build capacity and deploy a pool of national quality auditors, assessors, and mentors who are supporting the labs on implementing quality management systems across the network. We thank the foundation for building this level of sustainability in Uganda. To date, as already mentioned, there are over 35 labs which have attained international accreditation. So by 2015, the foundation entered into a 5-year cooperative agreement with CDC with the goal of providing technical assistance for strengthening national laboratory systems, Uganda under PEPFAR. This partnership has contributed to the establishment of a sustainable, efficient, integrated, and adaptable laboratory system and network that supports the national HIV/AIDS care and treatment plan, outbreak investigation, and disease surveillance at all healthcare levels in Uganda. We need to build on the success of the quality laboratory network that has seen over 35 labs internationally accredited and 80 lab hubs acquiring minimum standards for quality testing with at least a 1-star rating. It is important that we put into consideration sustainable financing, cost recovery, and resource mobilization to ensure continuity of quality testing programs beyond PEPFAR support. Successful establishment of an accredited cost-saving facility is critical to maintain laboratory equipment and reduce downtime, hence improving turnaround time. And establishment of a community of quality that will ensure maintenance of the lab accreditation status and continuous quality improvement across the lab network. So the foundation, this is a call to action to establish a community of quality. To conclude, today, as we have listened to the impact of the 5-year Foundation Cooperative Agreement with CDC, I take this opportunity to appreciate the Ministry of Health for the excellent collaboration and partnerships, and thank all the stakeholders for their support, which has strengthened the National Health Laboratory and Diagnostic Services capacity to efficiently coordinate laboratory services in response to the HIV/AIDS and other diagnostics with equitable and adequate geographical coverage at all levels. Thank you for the good work and wishing you all the best. That is from Dr. Lisa Nelson.